Welcome back, everybody. So memory loss, a big concern for many aging adults. Laura Schmid, a registered art therapist, and Janet Rice, a board-certified music therapist, are going to show us this morning how expressive art therapies help the residents with memory loss at Parc Provence. Good morning to you both.
Hi.
Good morning.
So for our viewers that aren't familiar with Parc Provence, and I'm sure there are a few, this is a facility designed specifically for people with memory issues. So where do art and music therapy play a role in the treatment of that?
Well, music and art therapy are part of the expressive art therapies, and they engage the entire brain. For doing anything with music, of course, it's invasive. You can't shut it out, so you're going to be moving to it. You're going to be emotionally responsive to it. With art, the same thing. There's going to be colors that bring out certain expressions in you. All this, like I said, engages the entire brain and brings someone along further when you're trying to reach them in stages of Alzheimer's dementia, which typically can be very isolating.
Sure, and I'm sure you wouldn't continue with a therapy like this if you hadn't seen real-world results. So let's delve a little into the two sort of one-on-one. Laura, let's start with you and talk about art therapy.
Sure, you know, art therapy is one of those professions that a lot of people may not have even heard of before. And it's common that it's misunderstood for like an art class or arts and crafts. You know, especially in long-term care communities where art's often used in this sort of way. But art therapy is quite different. Basically, it's therapy. So the art is used in a therapeutic way, and it's about the whole process of getting there. It's not about the final product.
I was just about to ask that because I feel like my work, I would be embarrassed to show it in front of everybody else.
Exactly.
But that's not the idea. It's the process. It's
right.
The artistic process, right?
Yeah, and you don't have to be an artist to participate. You know, it's the getting there, and art therapy is very process oriented. If you think of life's a journey and not a destination, that really applies here, and it's about the interactions that occur during the art making that are considered therapeutic for residents.
And it's shown to keep the brain active.
Right, yeah. When you're using art materials, you're engaging all of your senses. So it's a really nice cognitive exercise for the brain. If you think of looking at a picture of your childhood home, you know, a whole bunch of a flood of memories and emotions as well are going to come back to you. You may remember being a young child and getting off of your school bus and walking through your front door and smelling the smell of home-baked chocolate chip cookies that your mother baked.
Oh, wow.
So whether it's looking at a picture or maybe you're even creating it yourself, these memories and emotions are really going to just arise spontaneously through your senses.
Sure. And Janet, on your end, in terms of music therapy, I'm sure there's a little overlap in the way the brain responds to that.
Yes. Well, our brain's entrained to music since we're born. You know, we're hearing the mother's pulse in the womb, and we're responding to that. Music also brings that out in favorite songs that you hear, or people who are aphasic who can't speak will start singing, and that's a form of communication. Well, go to that person and just sing back and forth with them, perhaps. And that will be something that they'll use often, like I said, to communicate. Music also moves you, so you can tap your foot, you know, play a drum. That's a range of motion that's also akin to a functional goal, which you can eat. You know, now you can raise that fork up to your mouth to eat because you've been using it to play a drum.
And at the end of the day, really the goal is self-worth, maintaining or improving that self-worth. And I bet it's so rewarding to see that happening through these therapies every day.
Yes.
It's very isolating, Alzheimer's dementia. Often they lose their sense of self and their identity, and both art and music can bring out in them a sense of who they are, whether it's because they did a great portrait that day or because they have contributed something with the song. They've said something about, oh, that was my wedding song, or this is what I know how to do. I know how to pick great repertoire for the band. So this is just different cognitive levels, emotional levels, anything it can stimulate makes them feel more a part of belonging to a group of people.
And everybody in the photos we were showing folks at home, they look so happy. That's what kept getting us up in the office. Ladies, thank you very much.
Thank you.
Parc Provence is located in Creve Coeur. For more information or to schedule a tour, 314-542-2500 is the number to call, or visit parcprovence.com. Virginia, Kent?
Much more ahead in the next half hour of Great Day St. Louis. Is that hot, steaming cup of coffee you enjoy every day in jeopardy? Up next, we'll tell you how the U.S. is helping coffee farmers keep their crops from being destroyed.
And many will argue appearance matters. But what is your work desk saying about you? Well, we'll tell you and analyze some of our Great Day desks as well.
And if you suffer from migraines, then you know how excruciating the headaches can get and how difficult they can be to treat. Our next guest can help relieve your migraine pain without drugs. Details next.